Today we are going to demonstrate the PDO lifting threads on our patient Paula Abbott. She's a nurse practitioner and trainer for the American Academy of Facial Aesthetics. Most people, we can always think of ways to lift the tissue, and when we were looking at Paula's face, we were noticing that she's got that heavier cheek that's been giving her a nasolabial fold. She mentioned in the past that she's put a lot of syringes of filler in her nasolabial fold to try to improve it, but you know, that heavier cheek, that's always a problem that we see on a lot of our patients. So we're going to do a cheek lift, the 3-vector cheek lift on her. When we start to think about the folds of her face, if we look at the nasolabial fold, we'll want to draw our initial entry point here, which is about 1 centimeter to 1.5 centimeters from the lateral canthus. So I made that dot right here. And then we have the nasolabial fold. So we're going to go mid of that, and that's going to be our first vector. Okay, and I actually want to make sure that when I'm coming down with my lifting thread that I go a little bit past that fold so that I'm getting all those barbs to catch onto the nasolabial fold and lift that tissue. The next vector is going to be the marionette line vector, and that's going to be, so if you think of the corner of the mouth to the mandible border, it's going to be that midline right there as well. So that's going to be our second vector. And then our third, she's just starting to get a little bit of that jowling right here. So we're going to be right at the tip of the jowl, a little bit under, because again, we want to catch those barbs under the jowl. We're going to draw our line that way. Okay, so that's going to be her 3-vector lift. We're going to choose the 19 by 90 sharp threads for this, using the V-Soft brand. And then again, I drew my dot here. I always look at my thumb because that's about 1 centimeter, so about 1.5 centimeters from the lateral canthus. We're going to go mid of the nasolabial fold for the first vector. And also, just so you guys know, I already alcoholed and HIPAA-cleansed her face beforehand. So that's really important to make sure her skin is as clean as possible and before I draw my lines. And then I'm going to do the one right at the tip of the jowl. I know some of you might be thinking, she doesn't have a jowl, right? I mean, but we're our own worst critics, and we know the things that we can do to prevent, and it's just the beginning. These mild to moderate cases are the perfect person for a good lifting thread. And obviously when we've done Sculptra, we've done filler, you know, what are the other tools in our arsenal that we can use? These are really good ideas to help build collagen and help tighten up the skin.